And good afternoon, Santa Clarita. This is Tom Burton, the Orthopedic Program Manager with Providence Holy Cross Medical Center, and you're joining us on the Providence Holy Cross Health Hour, coming live from the Santa Clarita studios here in downtown New Hall. You're joining us on KHTS Radio, your hometown station. And, in the case that you're driving around, make sure that you pick up the app so that way you can pick it up not only locally, but globally. Works on the iTunes on your iPhone as well as your Android. With Holy Cross being about a 10-minute drive this time of the day coming up from the Valley, which was wonderful. We're a 377-bed facility we recently added on to try to accommodate the growing community and the growing need. 30% of our patients are actually coming from the Santa Clarita Valley, and 30% of our employees are actually living in the Santa Clarita Valley, which is interesting as well. And we found that it was so important that we've actually begun to throw satellite places up here in the Valley, where you'll be able to find us over in the around McBean and Valencia. A couple of our relationships that we've been able to go into joint ventures with. We're so glad to be a part and have this relationship with City of Hope, which is up here, bringing all of the magic that City of Hope was able to do in Duarte specifically, and bringing it locally to our patients and their families, which has been really helpful. So it makes it easier to be able to deliver that Class A care. Children's Hospital as well. And of recent, with some of the urgent cares, and of course, everyone will know FACey. FACey is being a part of the Providence family, and up here locally as one of the prime medical providers for most of Santa Clarita. So glad to be able to be here itself, and to be able to bring the show to you. And a big thanks to KHTS. Specifically Jerry and Carl, for their love of Holy Cross and the undying support that they give on a regular basis. Here we are today. It's funny because beginning of the year, Medicare made some really big changes to our total joint program, which really kind of threw us up in the air. And it really brings us the idea that between that and what we're recognizing with the issues with the flu going on, it's almost an epidemic or endemic in sense, that it only stands to reason that we would need a geriatric specialist to join us. And I don't know if it's to help navigate, but to try to bring more information. It's we're very lucky because our guest just joined us with Holy Cross, and it is looking forward to digging into the world of geriatrics and taking care of our elderly. And at this point, I want to introduce Dr. James Michail. And Dr. Michail, so you're a local kid, grew up in the San Fernando Valley. We were talking about it. Went to USC, a Pac-12 school, and people who listen to the show enough will realize that makes me smile inside. Just really digging in the Valley presently. We'll be working with Holy Cross on our geriatric care. Your father was a physician, so tell me a little bit about you. Historically, what all has been going on. What drove you to get into geriatrics, and then we'll kind of move on from there.
All right. So I got into geriatrics at an early age. It was just kind of unusual, but my father used to go in nursing homes and kind of ran on patients, and he had a love for the geriatric population. So I kind of caught on that early, and I kind of got accustomed to going to nursing homes as a young child, teenager, and those barriers kind of weren't there when I was going to USC. And at USC, there was a gerontology major, which kind of was a studying of aging from different perspectives, from the medical side, from the epidemiological side, from the political, from the policy side. So I just kind of got my gears going, and I knew I wanted to kind of become a geriatric physician. So at USC, I majored in gerontology, got a BS, went to medical school at St. George's, did my residency in New York, and finished up doing a geriatric fellowship in UCLA.
There we go.
So I kind of, and I haven't regretted a day.
Well, that's great. And of course, nobody who's listening will recognize, but as we were coming through the door to come into the studio, the senior hour was just finishing up, and Dr. Dorio, who is the local geriatrician out here, and Dr. Dorio had the opportunity you guys had the opportunity to meet, and that's exciting because it's we don't hear so much about this section of medicine And it's actually, there is a certification for this. Is that right?
Correct. Yeah, there's a fellowship. So I finished at UCLA, and they have a pretty big fellowship actually. It's about 11 or 12 fellows, and you just learn a lot about kind of the geriatric population. They have special needs compared to the general population. We look at different things for the patient, whether it's going to be falls or the amount of medication they're on, their living environment. So we kind of look at the total picture, because when you're older, if one of these domains kind of doesn't kind of work, or they kind of start failing, that's when a cascade of things happen in the older adult, and they end up in the hospital or in the nursing home, where we don't want them to end up, because they get infections and kind of delirious, and it opens up a whole box of kind of complications.
It does, and it's interesting too, because you'll actually have the opportunity to be able to enjoy the entire continuum of care too, where you could actually have them in the office. You can see them at the hospital, see them at the skilled nursing facility.
Correct.
You could do house visits, and as you mentioned that that you are also involved with some of the palliative styled care at one of the other facilities that you're at. So you really are working the entire continuum.
Correct.
Okay.
And it helps kind of seeing patients kind of, even though they're declining, kind of seeing and appreciating what they appreciate, and kind of realizing what, small things make them happy, and kind of as a geriatrician, it kind of motivates me to help them and continue in what they want, and kind of establishing the quality of life and making sure their quality of care kind of gets maintained.
Right,
So,
right.
yeah.
So I guess and we'll watch how you answer this question. What qualifies someone to be the elderly that would maybe come under your purview?
So an older adult essentially would be someone over 65 and older, but there's chronological age and biological age we always look at. So, you could be 65 but have a body, or, kind of a biological age of a 50-year-old. You could be 65 and have a biological age of 85, but it's all about habits and things you've done your entire life, whether it's smoking or drinking, or kind of your diet, things like that kind of affects your biological life. So
Gotcha.
Age is, just a number.
It is,
But,
and sometimes it's a big number, unfortunately.
It is a big number.
Yeah, it keeps growing too. That's unfortunate. Figure out how to stop that. So take it to how does, I guess one, as you're getting into practice, and this is probably an interesting piece, is that how do patients get referred to you normally now? Is it something where they're being referred to as an inpatient, or is it an internist that is finding that some of the pieces that are age driven would be better served by being treated by somebody who is used to working with that? How do patients get referred, or how do you build your practice with that?
So right now, it's just I have a network going. My father's got a great network as well. I'm kind of getting referrals from all over the place. There's a big need for geriatrics just in general. Even though we live in in Los Angeles County or in Santa Clarita County, we live in a bigger county, and there are not many geriatricians out there. So now, when there's a word of a geriatrician, everyone wants to kind of see how they can help their elderly, what kind of resources they have, and what kind of services they provide, because it's not services that an internist generally kind of reviews, whether if it's like a dementia care or falls assessment or a functional assessment. These are things that a geriatrician brings to the table that other doctors may or may not bring, but that's what we're specially trained in, and that's what I essentially specialize in.
It's interesting too, because the hospital itself, we're being looked at now by all hospitals, not just our hospital, but as far as also being population health, community care. And it's not just about the signs and the symptoms and delivering a plan of care, but it's actually having the knowledge of the resources in the community. And that's a strong point for what you do.
Correct. So for older adults, things like where do they get their meals and transportation and things like that seem kind of, for someone like us, we're mobile or kind of have access to different things, it's okay. But for an older person who doesn't have, the best eyesight, their cognition might be a little lower, they're a little deaf, they kind of try to stay home. And if they miss a meal or two, or they don't drink enough water, that could send them to the hospital. So kind of as a geriatrician, we kind of look for those things, those kind of red flags where we see problems occurring. And, we do things like Meals on Wheels or other kind of programs where the community can help the older individual. And the most important thing for an older individual is having a good safety net in place. It may not be formal organizations, but having a good family network, a neighborhood network. And I've seen a lot of older people thrive just on the networks they can provide in their home. But, the elderly people that are essentially at most risk are the ones that are isolated.
Correct.
And those are the patients, that end up coming in the hospital or end up in the SNF in worse condition because of the lack of social network. So if there's one thing I want to kind of stress is create a good social network, whether it's, at the dog park or,
Right.
At the local senior center, where it might not be, just creating more of a bigger social circle for you is the best way for a geriatric kind of a patient to kind of.
That's
go with
interesting,
it.
and it's funny because the isolated cases where maybe the family lives at a distance and they live by themselves, and maybe they don't get out. Maybe they do stay inside the house and they limit how much time that they actually go out. That was one of the concerns we had with our dad, and the was what would you deem as an appropriate way that when somebody does need to reach out, what means or this is a completely different direction than I thought we were going to go, but that's okay. We're here. That's the beauty of radio. So, what are the types of things that that we can maybe assist with in providing for our family members or our elderly, so that way they can, if they need something, they can get that assistance, whether it just be general assistance, like maybe through a cell phone or maybe through an alert. What are your thoughts on that?
So the good thing about this day and age is technology is really being able to assist medicine. I think that medicine and technology are kind of a great union. And for older adults, kind of just even having a webcam in the house. I've seen that happen. A lot of kids with older adults put a webcam in just to watch their older adults, because if you fall and you can't get to a phone or you don't know how to use a cell phone, if you're 80, 90 years old, you didn't grow up with a cell phone, you don't have one at home, you have a landline, how are you going to reach out? So things like a Life Alert or any of those companies and a webcam in the house, depending on the functional status of the older adult, are like kind of techniques we can use. But for me personally, I like using the technology because it's relatively lower cost and it's easily accessible to anybody out there. So
The webcam's brilliant.
webcam is the way to go. I mean, even especially if they kind of have help at home or caregivers, it's just good to keep an eye on them to make sure that they're okay, they're not falling, and things like that. So So I think modern times, I think that's the best way to go about it. And then the best way is having a neighbor or someone close by that comes and checks up on you once every day or two, or something of that nature, essentially. So kind of the social support network as well.
Yeah, it's the neighbor piece is actually pretty darn important, and we come across stories a lot where the neighbor will actually reach out to a family member and say, "Hey, listen, you know what? I've noticed that nobody's picked up the newspaper, or I've noticed, it could be that somebody's out of town, or however, but a lot of the times people will say, well, that it's just a nosy neighbor keeping it, but gosh darn it, anyways, that happened with us where the newspaper was sitting." A couple of newspapers were sitting on the driveway, and it was acknowledged that my dad was actually home. So was he sick? Was there an issue? Was there anything that's going on? And sure enough, he had actually fallen. And because of the fact that a neighbor actually looked, it really made a big difference. And, we can't impress upon our total joint patients, reach out to your neighbors. They're somebody that's going to be there, somebody if you can just give a quick call over to if they need anything. It's rely on others, because chances are they may need something from you, and these relationships and these friendships could be tremendous. And that was the thing my dad had said. He said, I never really looked to them, socially as much as I did recently. And he said, I didn't realize that I had such a great group of friends available to me. And I just never took advantage of it, I guess, or enjoyed that. So I think that's actually a really, really strong point. Now, one of the things you also mentioned, if they fall. All right, so both of us broke out the stats and see how our stats show up together here. I'll rattle the paper to make it sound like we're being seen on Facebook Live. So you can actually see this on Facebook Live as well. You're joining us here with the Providence Holy Cross Health Hour with Dr. James Michail, and I'm Tom Burton. And so let's talk some stats. Falling, we love gravity. We appreciate gravity. It allows us to enjoy an awful lot of the things we actually do. However, I was shocked when I looked at some of the numbers. So, I'll throw a couple out there that basically out of our elderly, 1 in 4 will fall. They're only going to bring that to the attention of their physician only half of the time. And that's devastating. And that the other piece of it was if they fail once, they're twice as likely to fall a second time, and then it builds in logarithmically from there. So tell us, what do you got over there?
I have every second there's a senior falls in this country,
Right.
which is pretty significant. About 2.8 million ED visits for falls, and those are falls these are the falls we hear about. So there's falls we don't even hear about, or the older person says, I fell, but it wasn't really a fall, I just tripped. But a trip can lead to a hip fracture. It could lead to head trauma, subdural hematomas, things of that nature. So, that's severely underreported, and the end result is catastrophic.
Right.
With falls, it's not very straightforward because there's multiple systems that kind of are associated with falls. It's kind of awareness, and it's about essentially, the vestibular system, your balancing, your vision, your hearing. So there's multi-systems involved. So that's why it's not very straightforward. And when older people fall, it's something we need to prevent, and they need to be more aware of and take it seriously.
One of the things we come across as an old physical therapist is that when we're treating people who have fallen, what a lot of the times they're very embarrassed to even discuss it, because it kind of ties into the idea that if I tell you the reason why I fell, then it's going to make people worry, and that's I can't take care of myself. And that once those conversations or that fear of that conversation coming up, then there's that loss of independence. And that's a really huge thing, right? For patients to actually have that sense of losing their independence, and they will fight to be able to maintain that. And oftentimes it seems to be that's the reason why some of the ones I've spoken to, they aren't reporting it, which is a really, really scary thing.
Independence, as well as not wanting to use a walker or cane. Those are the three biggest kind of reasons I've seen personally, and it is that's all part of losing independence, and that's something older adults kind of really, really kind of want to kind of keep. Obviously, we all want to keep our independence.
Absolutely.
So
I know we're coming up to a break here. We're with Dr. James Michail. We really appreciate you coming out here to the studio. You're joining us for the Providence Holy Cross Health Hour on your hometown station, KHTS Radio. Looking forward to seeing you back.
Lots of people can build websites, even your sister-in-law's cousin. But there's one Santa Clarita company that specializes in designing websites for your business. Small Dog Creative. The Small Dog Creative team are local designers who are hands-on. Their talented team of experts build premium websites and redefine branding. Small Dog Creative doesn't just build websites, they'll upgrade your business's online presence and turn your business into a powerful online brand. Small Dog Creative, Santa Clarita's most innovative web and design company. SmallDogCreative.com.
Santa Clarita's new Friday night happening place is Vine's Restaurant and Bar at the Hyatt Valencia,
Vine's Restaurant rocks.
featuring their prime rib buffet dinner.
Oh man, awesome buffet.
Prime rib, the best.
Our Friday feast.
Tomato basil soup, homemade.
Shrimp and Caesar salad.
Vine's Restaurant Friday night prime rib buffet, only $29.50.
The ultimate date night.
Make your Friday date night at Vine's Restaurant and keep every day of your week happy at the Vine's Lounge and Patio Happy Hour, 4 to 7 p.m. daily, featuring $5 appetizers and drinks.
Do you see it? It should be around here somewhere.
No, what was that address again?
Your building sign is essential to getting customers into your location. Feathers can help get your business noticed. They'll walk you through each phase of your building sign project, providing special attention to detail and quality. Feathers will give you a sign you can be proud of. Your building sign will draw customers in instead of having them drive by. Feathers on Soledad in Canyon Country, across from the Edwards Theater.
The Santa Clarita Artists Association has a new gallery in downtown Newhall on 6th Street between Main and Railroad, right across from the Canyon Theater Guild. The gallery features our members' paintings, sculptures, and one-of-a-kind handcrafted gift items. Whether you're an art lover, buyer, or an artist wishing to join, visit our website at santaclaritaartist.org, come to our free monthly meetings at Barnes & Noble, or stop by the gallery. For upcoming events and exhibits, check us out at santaclaritaartist.org. We make visual art visible.
With Facey Medical Group, good health is within your reach. Our doctors provide Santa Clarita's finest primary and specialist care at 4 convenient Santa Clarita locations. If you're looking for connected, convenient, personal care, there's no better place. We accept most health insurance, including plans offered through Covered California. Call 1-844-MY-FACY for more information or to schedule an appointment.
KHTS. Doctor, give me the news. I've got a bad case of loving you. No pills gonna cure my ear. I got a bad case of loving you.
Yeah, welcome back. You're joining us on the Providence Holy Cross Health Hour on KHTS Radio, your hometown station. I'm Tom Burton, the Orthopedic Program Manager from Providence Holy Cross, and joining me today and in studio, thank you very much, Dr. James Michail. And Dr. Michail, we were just getting into the idea of falling and just how common it actually is. You threw the stat out there: 2.8 million ER visits annually due to falls in our elderly. That's just the elderly. That's not taking into consideration other sports, things like that. This is just the elderly, anyone over 65. And one of the stats I found, 800,000 are usually going to be admitted either to head trauma or fracture. And when I saw the cost, I believe they said annually spent just treating falls, $31 billion, B as in boy, $1 billion is being spent in just caring for those who have fallen that year. Absolutely tremendous numbers. And perhaps maybe you just briefly started talking about it, but let's kind of go into a lot of the different things that might preclude somebody to a fall. Not only just environmentally, but also medically, vision. You keyed on it a lot of different things. And I thought maybe we can go ahead and pick that apart a little bit.
Okay, yeah. I mean, with falls, like you said, the number is astronomical, the cost, but the cost is just going to go up with the increase in baby boomers and the people over 65. So this number now is just going to balloon in the next few years. But in terms of preventing falls and what goes into falls, every case is different. It could be from medication. If you're taking some blood pressure medication, you stand up too fast, you can get orthostatic hypotension and fall. It could be from heart arrhythmias. It could be from a decreased sensation. If you have diabetes and you get the pins and needles in your extremities, that could cause you to fall. You name it, it could cause you to fall, really. So that's one thing, is you have to go to a physician and a physical therapist who kind of can see these things. And these are normal things for older individuals of age to have, but it's a matter of finding them and addressing them early before they get out of whack. So in terms of if you're having a fall or a near fall, go see your doctors, get a physical therapist, start being active and changing your life, changing kind of your activities in your life to kind of help accommodate kind of those the following risk factors.
Right, and it's funny because you mentioned the baby boomers and the baby boomers group, and one of the people used to be here at the station had, I don't know if she coined it or she borrowed it, but she called it the silver tsunami.
Yeah.
And that you have a huge population of people who are moving into that 65 and older, and the numbers are astronomical. And so, anticipation-wise, is that we're looking at numbers for a demographic or population that isn't quite as numerous as what it will be in the near future. And as advances occur where we actually live longer, I think the anticipation is we're going to see more of these types of injuries, and trying to address that early is going to be huge. They mentioned a lot of patients I talked to. They said, I spend more time seeing my physicians than I actually do seeing my friends. It's almost like a social network, if you will. Definitely on the holiday card list. But it's important to put together a team.
Correct.
Not only with their general practitioner, but a geriatric specialist would be extremely helpful because what's coming, or potentially what's coming. Perhaps with an occupational therapist or a physical therapist to work on, just daily skills as well as strength, as well as balance. A great eye doctor. For people who are wearing corrective lenses, it can be extremely difficult. As a bifocal wearer myself, those last 8 feet before my feet hit those 8 feet in front of me really are not in a really good place, and I really actually have to look down in order to be able to see. And if there's a vestibular problem, all of a sudden, the minute that head drops down, that can cause the spin, and people will actually have issues with their vision. So it is multifactorial.
Big time.
And then, so kind of take us through. So if you have a patient coming in, maybe on their first appointment, what types of things are you going to be looking at? How would you normally plan out that visit, so that you can get the best feel of what about that patient?
So I like to screen the patients, just watch how they walk is the biggest thing, kind of see how they ambulate, whether they use assisted devices or not, how they clear their feet off the floor, whether they have a limp or a foot drop, just kind of watching how they ambulate on a flat surface, and also timing them and seeing, are they slower than normal, are they not, and also having them get up out of a chair. So there's a whole bunch of techniques that we can observe the patient, kind of watching, and based on kind of my observations, getting kind of a plan ready, being, whether it's going to be physical therapy, whether it's going to be medication adjustment, whether it's just going to be a prescription for exercise, get up and walk 30 minutes every day, or, do some soup cans and kind of like lift them and things like that. So it's kind of tailoring it to every single patient and what their needs are. As a physical therapist, you've probably seen people walk different. I mean, everybody walks a little differently, just based from different, kind of upbringings and different diseases and things like that. So, kind of having an eye for that, kind of making sure that addressing if there's if the feet are at different levels of each other, kind of getting shoes that are kind of do things like that are really, really important.
It is. It is. In it, it's we battle with surfaces an awful lot. Whether it be tile, wood flooring, carpeting. The transitions are always the hardest.
Correct.
The idea of the concept, I appreciate you bringing up foot clearance, is that a lot of us will catch a toe when we walk, and just standard. I mean, every once in a while we kind of forget to kind of pull that foot up a little bit on a step. And so, when you're moving around and walking around the house and you're wearing maybe a tennis shoe, rubber hits carpet, that's like glue, and that foot stops moving. And, reflexes and such like that would require you to be able to correct it, but that's one of the more common ways we see people fall. So,
and getting a home safety eval start is another great way to kind of make sure that your home is safe, because a lot of falls do happen at home. The lights are a little dim, you want to use the restroom at night, you fall and trip over. So doing a home safety eval, making sure, if you're going to use if you use the restroom more than once or twice a night or at all, kind of making sure that it's a clear path. And, I have the same issue too. I get up in the middle of the night and I have to make sure nothing's in the way.
It's not just for the elderly.
Yes.
Right.
And, and another issue is, like you talked about, wearing tennis shoes inside your house is actually protective of falls. So, you think socks may help, or barefoot. The safest thing to do is actually wear shoes, like with good grip and things like that around the house. And getting a home safety eval will all go a long way in preventing a fall, because most of them do happen at home. You feel most confident at home, but it's kind of a false sense of confidence a lot of these times.
It is, and it's interesting because a lot of our HMO groups that we have the pleasure to be able to care for their patients for, they are now requiring a home assessment prior to patients going through a total joint replacement for exactly that reason. One, are there throw rugs? All right. So if there are throw rug, meaning the ones you put in front of the sink or the ones you put in front of in the bathroom, that those are hazards, especially if they aren't rubber backed, where they can actually slip. But it's something that can get caught underneath a walker, it can get caught on a toe, it can get caught on crutches, and so we want to pull all of those things up. The socks versus shoes, socks on tile. Really rough. Okay, we got the Olympics coming up, so figure skating will be interesting to watch to see how that plays out. But socks on tile is very similar to that, including wood floors.
Correct.
The cords across floors. A lot of the times we'll have electrical cords maybe running a fan or something like, because we don't want to have the air conditioning on. But if we don't navigate that, that's going to be a real rough one. And the night light. Gosh, it's so important. In bed, I don't know if they're advertisers, but local establishments here in the Santa Clarita area will sell 2-packs of night lights that you can go ahead and direct it straight down at the floor, and you can go ahead and illuminate the floor everywhere, inside the house that you normally would have to traverse if you're walking around in the dark. So all great pieces. Now, you did tie on medications, and I kind of wanted to revisit that a little bit. The concept with blood pressure issues, diabetes, and things like that. There are what the intent of the medication, blood pressure medications to try to lower blood pressure. A lot of times you can have blood pressure drop enough to a point where the heart almost has to like catch up a little bit in order to bring the blood to your brain, especially when you have a change in position. What other types of things should we look out for? So with blood pressure medications, we can see drops in blood pressure.
Yeah.
Diabetic medications
Can lower your sugar levels a little too much. What's also really important to remember, you may have been taking these medications for 10, 15 years, but when you do get older, your body physiology changes as well. So you may be more sensitive to certain kind of medications. People, older people are kind of more sensitive to diuretics. When they get more fluid loss, they don't have the same amount of fluid in their body that they did when they were younger, based on their fat percentage and all these different things that change as a normal person ages.
Right.
So medications also work a little differently. When you get older, you may not eat as much, but you're still taking the same amount of diabetes medications. Well, your sugar can drop down low, and if your sugar drops down low, you're going to be on the floor too. Unfortunately,
Right.
But. So different things like that are things to remember, and kind of, being in tune with your body and your health, and kind of realizing I'm feeling a little off, or, I have a little dizziness or something like that can be kind of at the tip of the iceberg, so to speak. So as a geriatrician, I like to kind of review all the medications and interactions between these medications before, we assess falls, things like that, because medications play a huge role in all these things.
And and we seem to see more of it being used, not and appropriately.
Correct.
And that has a lot to do with the fact that our population, as it ages, there are going to be times in which their systems are going to require some form of assistance from medications to allow them to work more appropriately.
And the medical community, I know, understands that the geriatric population is a little bit different. I mean, there's some recent guidelines for blood pressure have raised the minimum for the blood pressure limits for the older population to keep them up a little higher to avoid hypotension and falls. And the same with diabetes. They could put their A1C level a little higher just because they know they're more predisposed to hypoglycemia or low blood sugar. So things, the medical community understands these things, but at the same time, though, it's really patient, physician dependent.
Correct.
So it's really important to have a good doctor to kind of understand, the different changes in the body and kind of the effects of medication on an elderly and aging person.
Right. So it is something that's going to be important, that though we may have reacted, and believe me, I used to be able to run marathons, and now if I can get a mile out without dying, I'd be pretty impressed. But it's the same thing with everything, is that our bodies respond differently as we get older, and because of the natural progression of how our systems work, that we need to continue revisiting the idea of maybe some of the medications that we're taking, and make sure that they are appropriate. And I did see that the blood pressure changes. In fact, it occurred within a day of me having a conversation with my little brother regarding blood pressure, and that for certain age groups they want to see it at a certain spot, and for other age groups they want to see it at a higher spot. Exactly for the reasons that you're saying, that we kind of want to keep things going up to the old noodle, which is kind of important.
Correct.
And then you mentioned something about sensation. Now that's an interesting one, because people with you wake up, you sit funny, and you have a dead leg or however. If you can't feel what's going on in the leg, then chances are you're not going to know that you even need to react until it's too late.
Correct.
Now we'd see that with diabetes. Anything else we'd see that with?
A lot of some abnormalities from electrolytes, things like that. So if you have low potassium or different other dietary abnormalities, you can see that with. But in the general population, it's mainly with diabetes, and with that dysfunction, you get autonomic dysfunction. So it's not just peripheral neuropathy, but your blood pressure doesn't react as well. Your things like that. So it's a whole wide picture, kind of with the older adult, and kind of that way, in that sense. And even with diabetes, diabetes is kind of the biggest kind of thing we kind of, I see personally as a physician.
Right.
And everything gets affected, their whole from top to bottom of the body. And people who are diabetic need to have special care with falls, because they're going to have the neuropathy with their feet. They're not going to, their sensation's not going to be there. Their autonomic sensation, their blood pressure might not react as it would with someone that was when they were younger and things like that. So
correct.
It's a whole kind of spectrum of a disease with falls too, and that's a big kind of red flag usually.
It is. I'd like to spend a couple of minutes maybe before we go to the next break, is taking a look at you're in an interesting spot, because you have a group of people later on in their life. But if you had the ability to reach out to the youth of today. What advice, knowing what you treat and what the commonalities of what you're caring for, what type of changes would be a nice recommendation for those who are under the age of 65, maybe in their 20s or in their 30s, that maybe they can go ahead and take that to heart, knowing that these changes may postpone or minimize the issues they'll have when they actually may need you?
So it's the advice that everyone's heard their whole life growing up. Eat well and exercise, and those are the two things, even in your old age, can help you with.
Right.
So even if you're having falls and you have a lot of comorbidities, if you exercise, even if you're very frail, it's going to benefit you. So if you start early, it's just going to show on later in life. So maintaining weight, having a good, balanced, healthy diet, and exercise, things we've been told forever.
The golden standards. Right. But what do they know? No, you're absolutely 100% right. And it doesn't have to be something where they join a gym. They can just as easily. You have a full gym in your house. All right. You pay taxes on your sidewalk. You might as well go ahead and use it. Pick the ones that are safer to walk at. If you don't feel comfortable walking on a sidewalk, or if your neighborhood is not really well populated during times you want to be out and about, maybe going to the mall.
Mall walking, yeah, that's a huge one. The silver sneakers, things like that. We kind of really, I think it's an amazing program. So things like that. And the big thing about being an elderly is having a good social network.
Right.
Whether it's older people as well, kind of that's like what the mall walking does and things like that. It kind of brings them together. It's been shown if you're an older person and you're eating with other people, you bring a social kind of aspect to your life, it does go a long way. So
They're
that's why
healthier.
Much healthier, and that's like even senior center people in senior centers, they have a more of a sense of belonging to a community and different things like that. So that's why we always kind of encourage that for our older adults. But it doesn't happen all the time, but it's something we always try to encourage and make sure that they know it's an option.
Correct.
That they can use.
And then I like the idea of using cans. You can use milk jugs, things like that. There are things that have known weights to it. Things around the house. So you don't have to. It's not a huge expenditure. You don't have to. A lot of our elderly may be on fixed incomes. That a lot of the things inside their own house can create resistances that are going to be necessary. One, to help keep their strength up. Helps with bone health, things like that. So.
From personal experience, I've given my grandma like a couple of TheraBands to kind of just use around the house, and that she loves them. She watches TV, just using the TheraBand for her legs, for her feet, all these different things, and it's just a piece of rubber.
Correct.
So that's they're very low tech ways that we can help people. And as a physical therapist, you probably have a lot of experience in that.
It doesn't take much. Just gravity by itself has been extremely helpful. And to be able to use now. And then for those of you who have the opportunity, maybe joining in with a pool group, love the idea of maybe taking a little bit of gravity away while still maintaining muscle strength, especially if you are having any issues with arthritis. And that is one of the problems. Is it's one of those kind of like that downward spiral. Is that I need to exercise in order to stay healthy, but I hurt too much to exercise, and then they start becoming less healthy. Occasionally getting maybe physical therapy while we're bringing in a joint specialist to take a look at some of the injuries and see, because there's a lot of, not everything requires surgery. There are less invasive treatments that will assist in allowing someone to improve quality of life.
Correct.
Now, do you involve with that at all?
Yeah, I do knee injections just to help with the kind of knee.
The viscosupplementation.
Yeah, exactly. Things like that, and just to kind of help, symptomatically with the patient.
Right.
So that's what I try to use in the outpatient kind of setting. I've seen some positive results.
Correct.
But it really depends on the patient, what their pain threshold is, and things like that. But that's a very important thing. I like how you mentioned the aqua training, because I know there's like programs like Aqua Zumba and all these different things that people kind of like get into. But those things are very positive for older adults to get into, especially if you're having joint pain. It's a spiral, unfortunately, when you get a little older sometimes. But you have to maintain, as a geriatrician, as a physical therapist, our main goals are maintain what you have at the level you have it, and that's pretty much the biggest thing we can do for you.
Right.
Essentially,
and if there's an ability to improve, wonderful. But if we can at least maintain is really, really a big deal. And quality of life is a big deal. And it sounds like both of our professions allow for people to have that ability to. But we do need to be able to push our patients to be able to. Push is the wrong word. I try not to do that. But direct our patients, encourage our patients to try to get a little bit more involved, because when we have that ability to do so, they're going to benefit so greatly from it. And the energy levels that we get a chance to see, the safety in and around the house, and again, we talked about that level of independence, and that the patients who are in better shape, who are becoming more involved, get that sense of independence. I know we're going to be swinging to a break, but I'd like to maybe just for a minute or so, what types of, you mentioned something about transportation. What is available?
It depends on insurance and things like that, so it's really hard for me to kind of expound on that.
Right.
But I think it depends on some case basis. This day and age, we have Uber and
Right.
Lyft,
Right.
but there are programs that kind of help the older adult with Uber and Lyft. I don't know any companies off the top of my head, unfortunately,
Right.
but a lot of times what I see is just the family helping and just bringing them in, because having an older adult come to the office is fine, but if you give recommendations, they might not be able to follow them. So kind of having somebody there kind of make sure, depending on the level of functioning of the older adult, kind of making sure that they understand the changes and that they understand the different things. So it really depends on how far they live, different things like that. So
Gotcha.
And I know New Hall's a little different than the Valley and things like that. So
Right, and you can always check in with your city to find out if they have anything that's available. I know sometimes within their transportation department they have things maybe for seniors that would allow for assistance being able to get to places. The MedTrans, I know Medicare offers. I believe they have certain arrangements access.
all these things.
Things with your regular insurance may actually cover. Especially ones getting to the physician's office, which maintaining those appointments are going to be huge.
Good point. Yeah.
So I know we're taking a quick little break here. We're going to wrap up. We're going to have to figure out how to meet and follow up with Dr. Michail here so we can make sure that you can get there. So we're with us with the Providence Holy Cross Health Hour on KHTS Radio, your hometown station.
My favorite restaurant in Santa Clarita? Salt Creek Grill, of course. Great food, neat atmosphere.
For a business lunch or romantic dinner, I'll always go to Salt Creek.
Hi, I'm Greg Amsler, owner of Salt Creek Grill. We have created Salt Creek to provide you with the most comfortable and inviting restaurant in Santa Clarita. Enjoy fresh mesquite grilled fish, aged steaks, and the best chops imaginable. There's entertainment every Friday and Saturday night, and we have the best Sunday brunch in town. Salt Creek is on Town Center Drive in Valencia.
If you're in danger of losing your home to foreclosure, you need an expert. Hi, I'm Rich Sherman with Alta Realty. I've helped hundreds of Santa Clarita residents save their homes completely for free. I've got just over 20 years experience and a loan modification success rate of over 80%. I can negotiate better terms with your bank, and I can save your home from foreclosure. And again, we do this completely for free. So if you're in any danger, please call me today at 661-714-1400. That number again is 661-714-1400. I'm Rich Sherman with Alta Realty. I'll be happy to help you save your home for free.
It isn't often when we see a company launch in Santa Clarita and become an international sensation. In 2010, Jen Gerard founded Whitening Lightning in her Valencia kitchen. Now it's a booming international sensation. Leading actresses and international models have switched to Whitening Lightning to avoid the mess, hassle, and sensitivity of other products. Whitening Lightning's simple Dial a Smile kit will dramatically turn your teeth whiter in just 20 minutes. Rediscover how white your teeth can look. Visit whiteninglightning.com. whiteninglightning.com.
KHTS. Doctor, give me the news. I've got a bad case of loving you. No pills gonna cure my ear. I got a bad case of loving you.
And welcome back to the Providence Holy Cross Health Hour. You're joining us here today in studio at the KHTS Radio, your hometown station. And I'm Tom Burton, your orthopedic manager from Holy Cross, and being joined by Dr. James Michail. We've just been chatting about possibly where we're going to eat afterwards, perhaps. But more so importantly, as we've been discussing geriatrics, our elderly, how multifactorial it is, and how you would begin working with them on taking a look at everything: social, medical, medicinal, physical. And we talked about the idea of a patient finally getting in to come and see you. But how do they get in to see you?
Well, I mean, it's
And where do they see you? And how do they reach you? And where do they call? Are you online?
It depends on if they need a referral or not, or they can come give me my office a call and we can check up on that. So my office is in Panorama City for the moment. Well, it's going to be there.
Yeah.
But I'm looking to expand soon. So they can always give me a call at 818-787-1049.
Okay.
And it's Dr. James Michail, Michail.
Okay, and then is the address of the clinic?
Okay, it's 14860 Roscoe Boulevard, Panorama City, California, 91402.
Perfect.
Suite 201.
Suite 201. And then can they find you online? Do you have an online presence yet?
Not now. I will work on it right now. So
Okay.
I just started a few months ago, about 6 months ago. So still
Right,
trying to work on, but no online presence for now. They can Google my name. And they can see my office address and all that, all the good stuff on there.
They can find you.
They can find me online.
Which is going to be really,
Correct.
really helpful. And
Correct.
then as far as general insurances are on most of the panels, or?
Yeah, well, I'm working on that too right now. Yeah,
So
kind of
hard.
work. Yeah, it's a lot of work. So that's kind of more. It's harder work than medicine sometimes.
It's funny. We giggle about it only because if for those who are listening, if you've never actually seen a credentialing packet when you're trying to get onto an insurance panel, they're roughly anywhere from about 60 pages. That there is a lot of stuff that you have to put in there, a lot of redundancies, and when you send that in, you're going to get a phone call back in about a month and a half because you didn't hear anything from them. And they're going to say, did you ever have that opportunity to be able to send that in? But I did send that in. So just to let you know that it is actually, if you're waiting for Dr. Michail to get onto its specific insurance panels, it is tedious. It's a lot of work. And it's the side of medicine, if you will, that I don't think school prepares us for.
Yeah, they didn't. It was not in my application.
Yeah, it is so tough. I do think that in having this conversation, for those who are listening, if you are concerned over a family member, as far as that, are they getting the appropriate, as far as the medicine, not appropriate medicine, so they probably could be extremely appropriate. However, that knowing some of the warning signs, the red flags, as Dr. Michail, you mentioned, if you're wondering how those red flags and how this is adding up to your family member's safety, I do say please call. Okay, get a hold, have your internist refer your family member. Extremely important for those of you who are elderly and are questioning because you're noticing that that maybe there's balance losses, or that you're noticing more so now that you are finding that there are areas of dizziness or such when you're trying to get up from the chair, more so than what you can remember. That it could be something very normal in the process, and that though it's normal, it still needs to be addressed, and that and should be addressed for safety.
Correct. And it's medications you don't even kind of think about. You can be taking prostate medication that could be causing this. So it's you need a good medical eye and someone who's attuned to geriatric kind of care to do that. And a lot of internists are, but it really is on a case-to-case basis in terms of what they can offer you.
And I can't be happier about the certification, the board certification that's becoming available now, because having been in the Valley and up in Santa Clarita treating for almost 30 years now, you are the first board certified geriatrician I've ever come across.
Oh, wonderful.
As opposed to people who have treated, it's refreshing to see that the medical community, similar with palliative care, where they've turned that into a specialty. Now they've been able to, and hospitalists now become a specialty. It's nice to see that that we've created these subspecialties that will allow for our patients to be better cared for in a cumulative manner.
And it's vital, I think, to have good care for the older adults, because the numbers are just going to get bigger, and our biggest healthcare expenditure is on older adults. It's not on the young people under 50. It's the older people who have 3-4 medical problems or being hospitalized every few months and things like that. So it's really imperative that people kind of understand that geriatrics isn't a flashy field or anything like that, but it's an important field, especially for this country and for our financial stability.
And we know that population. I believe the last stat that I had seen, about 80% of all medical expenses are paid towards the care for the elderly.
Yeah, it's a lot. We need to bring in nursing homes and hospital care and home health costs. And then on top of that, if you get a disease like Alzheimer's, where you need round-the-clock care, then it just becomes a huge cascade of issues. So that's why we got to kind of target our older adults early, making sure that quality of life is maintained or improved if possible, and going from there.
Exactly.
So,
Exactly.
So, it's kind of making sure that they, making sure you're, whatever time, whether it's going to be 30 or 40 years left, is a quality and great time for you and your family.
Correct.
And trying to stay at the hospital and in the house happy and kind of going from there. So that's kind of my main goal as a geriatrician, kind of to keep your quality of life and your satisfaction in your life, and most importantly, your independence stable or improved, and it's small things, maybe changing a medication or taking one out that was affecting you badly and going from there. So
correct. And, and now we only really focused in on falls truly today. But, as far as Alzheimer's and a variety of other cognitive type disorders, these are going to be things that will make for a whole nother interesting conversation in the near future, which would hope you'd be able to join us for that, which would be great. But we also want to be able to say that though our discussion today was for the elderly 65 and older, for those of you who are listening who don't fall into that population, realize that a lot of what we're talking about are things that we can make really great decisions when we're younger to either avoid, which would be wonderful, or we can definitely get into a more healthier us that will allow us to have less of an issue with. So that way, maybe that isn't something that you would need to be caring for with us when we get to be that age, which is probably very satisfying too.
Correct.
So we actually can make differences even now. So that way, when we get to the group that you have so passionately taken care of, we might be able to make your job easier.
Hopefully. And honestly, even if you're under 65, it's also good to have an extra set of eyes and ears out there looking at your grandparent or your aunt or uncle and it's kind of seeing, if something's a little abnormal, mention it to them. They might not be aware of it, but, if you mention, hey, Uncle, Rob, why are you limping? Or why are you doing this or this? That can go a long way. Go check it out with the doctor and see what happens.
Exactly. So we as family members or as caregivers, we need to keep an eye on some of those things and maybe focus a little bit more big picture instead of tunnel visioning ourselves on the specific piece that that patient may be referred to us to, or or maybe we were going over to help a family member with a chore, but maybe we should take a look at everything else that's going on inside the house.
Correct.
Well, hey, listen, thank you very much for coming out to Newhall here at the KHTS radio station, your hometown station. You've joined us on the Providence Holy Cross Healthcare Hour, and really looking forward to having you guys next month. I believe we're going to be discussing infectious disease. Doesn't that sound great? So but it is actually something pretty exciting. So thank you very much. We'll see you next month.